Hi, this is Jim N4BFR. It's Friday. That was lame. It's Friday, the 21st of August, 2020. Here's your COVID-19 update for the state of Georgia metrics. Testing came in above the 7-day average today, but that was down almost 5,000 from last week. So that is definitely a significant change in the volume of testing we've seen, and we need to continue to keep an eye on that. Now, the other thing to say here is cases are down by 700 in the last 7 days, which is a nice, healthy decline. If we look at where we were at 3,500 average. Now we're at 2,700, so that's 1/7. That is a not insignificant decline, and so we will take that and keep watching. Now, looking at the case numbers, there was a net increase of 2,889 cases reported on Friday, and that is down 10% from last week. Again, we talked earlier in the week about how net new cases are different than what the Department of Public Health reports as new cases. The gap today was about 100. So they had 2,989. I had 2,889 for net new, which means there were 100 cases that were reclassified or duplicates or whatever in their list. Deaths neared 100 today. We had a net increase of 94. That was up 59 from last Friday. You remember we talked about last week. There was discussion because we had the big days earlier in the week last week. Would we see a Friday spike? Friday was the one day we didn't see a spike. We really had Tuesday, Wednesday, Thursday, Saturday as high days last week. This week, we're back to having Friday as one of the higher days with 94. The interesting thing about 94 is it puts us at 4,998 deaths as of the beginning of the pandemic. So tomorrow, unless we have one of the very rare 0 or 1 death days, which that's only happened 4 times in the last, call it 170 days or so, we will break the 5,000 death barrier tomorrow. So we've been talking about that was going to come up this week. We pretty much know that tomorrow will be the day that will be in the news. Hospitalizations were flat with last week at 245. The really interesting thing in the hospital world is we had a big drop in active COVID-19 beds. We dropped 100 beds to get down to 2,408. That is our lowest since July 9th. So you can really see that curve that peaked up the last week of July. The first week of August is really now coming back down. We've dropped 500 in the last couple of weeks, and with the big drop today, that's really beneficial for us. So hopefully our hardworking healthcare workers are getting to take a breath, and hopefully we don't see too much of a spike from back to school, but we won't know until we know in the next couple of weeks. Speaking of back to school, here's today's list that I compiled. Couple of interesting things on this one included Effingham County High. They have quarantined 130. We have a new case in Fayette. We had not had cases there before. Floyd County Schools, they had said yesterday all schools are going to go to virtual learning. Today, they said, wait, we changed our mind. Only the 3 schools where we had cases are going to virtual learning. So that is where it currently stands as far as Floyd County goes. We added some Forsyth schools thanks to a Reddit tipster. We had some additions in Houston County. So the Middle Georgia area gets going there. Jackson County Schools just reported a combined 7 cases and 80 impacted. And then Atlanta Public Schools haven't reported any cases yet, but they haven't started yet, and they're going to start with all virtual learning. So I just kind of wanted to make sure we had that data point in there that they start on Monday with virtual learning. Finally, the last thing that's been in the news and certainly up for a lot of debate is, should teachers be classified as essential workers? And there's if you go into the school list, you'll find a link to an article. It talked about that in the Georgia School Superintendents Association, there were about 150, I think, 150-ish superintendents and leaders in that group, and only 12 said they shouldn't be classified as essential workers. That's gone to Governor Kemp, so we'll see where that falls in the next few days. Typically, I've got a CCU update for folks, but as of 4:30, the folks at Department of at GEMA, they're the ones that put out the CCU data, had not published that yet, and decided I didn't want to wait around. I wanted to get this post up, and we will get that caught up tomorrow. So hopefully we're going to see the same kind of decline in CCU beds that we're seeing in active hospitalizations, but we haven't seen it yet. Remember, we had that little drop earlier, last weekend, earlier this week, and now it's kind of rattled back up to that 86% range. So we will keep an eye on that as we go forward. I think that's it for today. Watch for some updates tomorrow as we get the new information in. I think you'll see a lot of media discussion as we pass this pretty significant death benchmark, so I would expect more news from that perspective. And I also think we're going to be getting close. It could be a double whammy because we're at 249, 630 on cases. So we only, an average 2,500 day would put us over 250,000 cases and 500,000, or 500,000, I apologize, 5,000 deaths. So it could be an interesting day from a media perspective on this. I noticed that the governor's office put out a tweet today with a viral video, they're hoping it goes viral, I'm sure, that basically said, the economy's coming back and we need to stay focused on COVID. So I agree we need to stay focused on COVID. I probably disagree with how we stay focused, but that's all for another video as well. Thanks to everybody for checking in today. Have a great weekend, and I will be back tomorrow with all the breaking updates. See you then.